During an influenza pandemic, as we all realize, the workplace can be a source of transmission just as in other settings. Fortunately, because OSHA has previously prepared for a possible outbreak of pandemic related to the avian influenza virus, the agency is now fully prepared to address the dangers of the 2009 H1N1. The full range of OSHA's training, education, enforcement, technical assistance, and public outreach programs will be used to help employers and workers protect themselves at work. Preparation is critical. Proper planning will allow employers to better protect their employees and reduce the impact of the pandemic on society and the economy. OSHA has developed guidance to help employers determine the most appropriate work practices and precautions to limit the impact of the influenza pandemic. Because pandemic-related health and safety risks are greater in certain workplaces, OSHA is focusing its direct efforts on educating employers and employees in high-risk exposure categories. OSHA uses its occupational risk pyramid for pandemic influenza, which is projected on the screen, for both its own determination and for employers to determine those workplaces that are at higher exposure risk level. The pyramid visually demonstrates that only a small portion of workers are at the highest exposure risk level. In response to the 2009 H1N1 outbreak, OSHA's current outreach efforts are primarily focused on high-risk and very high-risk workers, those who have direct contact with infected individuals as part of their job responsibilities, such as healthcare workers and first responders. OSHA recognizes the importance of protecting healthcare workers on whom this country relies to identify, treat, and care for individuals with the flu. Our frontline healthcare workers are the foundation upon which our healthcare system is built. If they are not able to work due to illness or unwilling to work due to fears for their health, then individual patients and the country's entire healthcare structure will suffer. To help healthcare employees and workers prepare for an influenza pandemic, OSHA has developed a pandemic flu preparedness and response guidance for healthcare workers and employers. This publication provides valuable information and tools which healthcare workers and healthcare facilities can use to protect their employees. If we expect our healthcare workers to come to work each day during a pandemic, then their employers have a responsibility to ensure that they have the best protection, including engineering controls, administrative controls, appropriate respirators, and other personal protective equipment. And I also want to remind you that we can't forget the custodians, security guards, and administrative employees and maintenance workers who support these high-risk workers. While generally not at high risk themselves, if we're to expect them to report to work every day to carry out their critical functions, they also need to be educated about the virus, their level of risk, and situations where they are at risk and how they need to protect themselves. It's our expectations that most of this nation's hospital and healthcare institutions, where workers are clearly at exposure risk, are fully prepared to provide that training, equipment, and protection. And if they are not now prepared, that they are working hard to finalize plans to ensure that they will soon be ready for an outbreak. These plans should include ordering and stockpiling respirators and other personal protective equipment, conducting fit testing, medical evaluation, and training for those required to wear respirators. OSHA and CDC have distributed extensive information on how to protect workers. Employers play a key role in protecting employees' safety and health, and OSHA will continue to provide them with the technical assistance they need. But OSHA also stands prepared to use its existing authority to aggressively enforce safe work practices to ensure employees receive appropriate protection. In appropriate circumstances, OSHA will use the General Duty Clause of the Occupational Safety and Health Act, which requires that employers follow the practices that public health experts agree are necessary to protect workers' health. OSHA also has standards addressing housekeeping and personal protective equipment, as well as a respirator standard that requires the complete respiratory protection program for employees. It's the employer's responsibility to ensure that we have the protection and training that workers need: when to wear a respirator, what kind of respirator, how to get the respirator fit tested and wear it properly, when to wear gloves, and how to put on and take off personal protective equipment. OSHA is also developing additional information for workers and their employers in the pandemic influenza, including fact sheets and quick cards that are appropriate for workers to use. Many of these materials are on our website and also on pandemicflu.gov. Mr. Chairman, I'd characterize this situation for the workforce just as the President has described it for the nation: cause for deep concern, but not panic. I'm very confident in the expertise of OSHA's medical, scientific, compliance assistance, and enforcement personnel. OSHA is prepared to answer the threat and will protect the workforce. I will keep this committee informed on OSHA's efforts to protect working men and women from the pandemic flu exposure. Thank you very much.